So let's make the great beginning. A lady delivered a normal vaginal delivery and was discharged. And on third day, she came back with fever, tachycardia, and seizures. There are no focal deficits. What is the most likely diagnosis? Please keep punching your answer, doctor. Madhu is proposing cortical vein thrombosis. Absolutely right. Yes. So what you are seeing is papilledema. And papilledema is one of the presenting features once there is a rise in intracranial tension, which can happen in cortical vein thrombosis. There are no focal deficits. That's an important clue to say that it is not migraine or anything else. Now, doc, in the following endometrial biopsy, the histology is being shown to you. This is the histology. Have a good look at this endometrial histology. And what does this histology basically represent is my question to all of you. Yes. Give one confident answer, doctor. Is it a high estrogen, high progesterone, high level of prolactin? What's the possible answer? Yes. Madhu is proposing A. Good. How about others? That is the high estrogen is Madhu's answer. Keep punching your answers, doctor. Right? Yeah. Yes. So it is a case of endometrial hyperplasia, which typically is associated with high estrogen is what you have to basically remember. A 32-year-old female came for a routine pap smear testing, and the following is the cytological appearance. So what is the next step is the important question. So looking at this histological appearance, what do you feel in the cytological appearance in the pap smear? What is your inference? Do you think you need to go for HPV, DNA testing, hysterectomy, conization, or a colposcopy and biopsy? So what's your answer, doc? Good to see 20 online students. Padmanabha is proposing conization, and Mangesh Sinde is proposing hysterectomy. Okay. So what are your other options? Come on, punch your answer. Madhu, what is your answer? Give one confident answer. Yes. So, yes. Very good. Ritu Raj is proposing colposcopy and biopsy. Absolutely. This is a carcinoma in situ is what you are able to see. The carcinoma in situ, typically the next step in evaluation is colposcopy and biopsy. A 61-year-old post-menopausal woman with the family history of ovarian cancer, family history. She has pain abdomen. She is on hormone replacement therapy being postmenopausal. An abdominal ultrasound has been done to you. And what you are able to see in this abdominal ultrasound? You are able to see a cyst with a smooth wall. So this is the typical cyst with a smooth wall is what you are able to see. So in this scenario, what is a reference? Do you want to observe and reassure her, or do you want to do laparoscopic surgery? Do you want to drill that cyst or check the CA 125 levels? What is your choice, doc? Question number 4. Ritu is proposing observe and reassure. Vanapartri Vanishri is also proposing the same. Good. And very good. But you need to check CA 125 levels in view of her family history. And then if it is normal, then advise her to come for a regular follow-up is considered to be the management of choice. Now, doc, what is the next step in management of this 32-year-old woman with a 5-year history of primary infertility, and you have done her hysterosalpingogram, where you have passed the contrast, you are observing the uterine fundus, you are looking whether it is passing into the fallopian tube or not. So based on that, what is your diagnosis of this hysterosalpingogram, and accordingly, what is your plan of action? As assisted reproduction specialist, some of you are going to be. We are a populous country with a humongous public health issue of infertility. Yes. So, Vanisri is proposing tuboplasty. Rituraj is proposing laparoscopy and hysteroscopy. Okay. So, question number 5. Please mention the question number. And Madhu is proposing in vitro fertilization. Okay. And Raji is proposing in vitro IVF. No, doctor. Ritu Raj is rocking with the correct answers. Very good. So, laparoscopy and hysteroscopy are considered to be the most important things, and what you are seeing here is a bilateral tubal block, is what you should remember. Now, you have been shown the transverse view of the fetal brain. Transverse view of the fetal brain. So, based on that, you try to make a diagnosis of an infection, congenital infection, and tell me what is true regarding the congenital infection which is being depicted in the transverse view of the fetal brain over here. Good to see 32 online students, all birds back to the flock. It is the evening time with Dr. Murli Bharadwaj, every day for you to become well activated in this free session in the evening for the preparation for the NEET PG entrance exam. So, let's look into your answers. Question number 6. So, which is that congenital infection typically leading to an appearance of the fetal brain like this? Then if you can tell me what is that infection, then we can make the diagnosis. Ritu thinks it is B, right? Yes. So, what are the others thinking? Satyasnigdha Tripathi is proposing B. Madhushri Manya Jindavad, Satyasnigdha also correct. CMV infection. CMV may this kind of periventricular, around the ventricle, periventricular calcification which you are seeing is the classical feature. Have you answered fatafat bolo doctor? Madhu thinks A, diagnosed only by persistent presence of IgM antibody. And Satya is thinking B. He thinks it is the most common cause of the non-syndromic sensory neural hearing loss in a newborn baby. Yes, so you're all toggling between A and B. A and B, very good. So you should remember, CMV is the most common cause of the non-syndromic sensory neural hearing loss. Mangesh, Parkin, Amrita, all of you are absolutely right. A 5-year-old child is being brought to the hospital with a history of loose stools, but no history of fever or blood in the stools. Mother says that he is irritable and drinks water hastily when given, and on examination you can see him in the skin pinch test. The skin is retracted within 2 seconds but not immediately. So now the question comes, what is the treatment of this child? So look at the child, appearance of the child. and all the details being given to you. So what is your choice? Give an answer, doctor. Very good. Good to see 38 online students. Yes. So, do you like to give IV antibiotics? Do you want to give oral fluids? You want to start IV fluids, IV antibiotics? Or do you want to give Zinc supplementation, oral rehydration only and ask mother to come back? What is your choice in this child? Yes. So, most of you, Shivendra Rai, Sara Kaderi, and Kishore, you're all proposing D. Shilpa Reddy also. Very good, doctor. On examination, eyes are sunken, which is a sign of severe dehydration. So that is the reason option D is because still if he can be able to take orally, you can. That should be our first choice is what you should remember. Right? Now, a 6-year-old child typically presents with fever, pancytopenia, generalized weakness, and weight loss. And on examination is pale. There is a generalized lymphadenopathy. And this is the peripheral smear. Rather, this is the bone marrow appearance. After looking at it, what is your conclusion in this 6-year-old child? Very, very easy question. Easy question to answer. Question number 8. Satya Snigdha Tripathi is proposing B. Ritu thinks AML. AML in a small child. Right? Yeah. What's your answer, doctor? Padmanabha thinks AML. Oh, you're all seduced by the appearance of the AML. No, doc. Ranjit Shah, Shivendra Rai, absolutely right. It is an acute lymphoblastic leukemia. Always pediatric means you should think of the possibility of the ALL. Right? Now, the patient presented with fever, cough, expectoration, and you have taken the chest radiograph. Now the question is, looking at this, Rituraj says big mistake, definitely. That was an easy question to shoot, and the mistakes that you do, doctor, when 1,60,000 aspirants are fighting with you, you can't miss a catch like in cricket. Be very sure. So, Ritu, no worries. Some catches are missed, but still we will win the game. So now looking at this radiograph, the finding in the radiograph, what is your answer? What is the most likely causative organism is my question to all of you. Very good to see 41 online students. Now there are no traffic jams. I am delivering this class directly sitting in the home. So that is the reason we will try to start the class by 6 o'clock as much as possible, right? So please do come and log in. Be mentally prepared 6 to 8 to attend the class every day, and Monday to Saturday. And on Sunday, 12 to 3 will be the grand test and discussion. Yeah. So please tell all your classmates also to log in on time to enjoy a couple of hours of full active energy session that is required, doctor, right? So I can see most of you. Shivendra proposes Staphylococcus, Ranjit Shah clean bowled, Vanaparthi clean bowled, Radhika Pillai clean bowled. Oh, pneumatocoel and Staphylococcus aureus. It is an easy question, doctor. You can't afford to do a mistake, right? Now, Staphylococcus aureus, there are few points to ponder about it. So you should remember infants and children. They are characteristic pneumatocoels. It does not lead to lobar pneumonia, rather it leads to bronchopneumonia. It is multifocal, it bilateral. There is an air bronchogram, generally in pneumonia, but that is unusual in case of Staphylococcus aureus. Lobar involvement also unusual for Staphylococcus. Staphylococcus leads to bronchopneumonia pattern. Lot of times this question was asked. And it can lead to cavitating pneumonia, pleural effusion, hydrothorax, hydropneumothorax, and characteristic pneumatoceles. So, Staphylococcus pneumatoceal. You are not going to forget for the tomorrow's exam, right? Now, doc. In the surgery, the orthopedic surgeon is asking you for a bone holding forceps. Bone holding forceps. Correctly identify out of these things which is a bone holding forceps is the favorite question of the examiner. Wow, good to see 60 online students. Very good, doctor. Very good. Very good. I'm so happy that you all came for this today's session. Also ask your friends to also come, right? So, Tanveer Sodhi is proposing C. Rituraj thinks C. Satyasnigdha Tripathi thinks B. Madhu thinks B. Amrita thinks B. Very good. But bone पकड़ने वाला forceps को सही तरफ आंसर करने वाला खाली राजा दुरई is born to become a top orthopedic surgeon. Raja साहब आप कहाँ से हैं? Raja Durai, you are from which part of Tamil Nadu? Yeah. So very good. So doctor, option A is the one. So this is how a Kern's, it's called Kern's bone holding forceps is what you have to fundamentally appreciate, right? That's good. Chandrakant says option C is called bone nibbler. Absolutely. So now the following lesion which is being shown in the radiograph of the foot in a college gymnast. College के gymnast radiograph दिखाई दे रहे हैं आपको, right? So this is a radiograph that is being taken with some gap. This is the initial one. Later on, this is a later on lesion. Now, doc, looking at it, you have to perfectly answer it correctly. Otherwise, you need to go back to orthopedics in the onlinembbs.com video library. There are about 40 topics. There is a section called 650 high-yield topic discussion. We discussed point-wise on every topic, about 50-60 points we discussed. So you need to go back to the orthopedics and then do a review of those videos if you did this question wrong, right? So I can see Vishalakshi is proposing March. Radhika says March. Good to see Lawrence. I'm really missing you because I'm not coming to the Nampally Center, but it's good. I hope you are quite active. At least for you, one of the days I will try to come to the live class like our old format. So Chandrakant Haidar is proposing B. So Mangesh thinks it is toe 5, completely clean bolt. So doc, it is March fracture. So you should remember that the March fracture is a fatigue fracture, is what you should emphatically remember. Now, in the fracture which is being seen below, in the X-ray, what is the most commonly expected vascular injury is my question to all of you. फटाफट बोलो डॉक्टर, ये जो एक्सरे में जो हम फ्रैक्चर देख रहे हैं. So question number 12. Good to see Lokesh Murali after a long time. So Rajit Shaw, is proposing brachial. Very good, very good. Nice to see 70 online students on time. Very good. So, Satya Snigdha Tripathi is proposing A. Tanveer says A. Brachial artery. Absolutely right.